Hi everybody, welcome to PharmaExplora. Today we're going to talk about another healthcare system model in detail. The Bismarck Model, beyond universal coverage, private players, public oversight. I would like to remind you that we have previously discussed what a healthcare system is, provided a brief overview of 4 basic health system models in the world, and covered the Beveridge Model in detail. You can watch those videos from the links provided in the description. Let's begin. The Bismarck Model, named after the influential German Chancellor Otto von Bismarck, stands as another prominent healthcare financing system with a long and impactful history. It operates through mandatory health insurance schemes funded by payroll contributions from both employers and employees, ensuring broad coverage and shared responsibility. Germany is a good example of a country with a well-established Bismarck healthcare system. Mandatory health insurance, payroll contributions, private insurance funds, and state regulation are considered the core principles of the Bismarck Model. Now let's take a look at each principle separately. Mandatory health insurance. Every citizen and resident is required to enroll in a health insurance plan, eliminating gaps in coverage due to income or employment status. This promotes social solidarity and collective risk sharing. Payroll contributions. Both employers and employees contribute a fixed percentage of their salary towards health insurance premiums, creating a sustainable funding mechanism. This approach helps mitigate reliance on government taxes and individual out-of-pocket expenses. Private insurance funds. The healthcare system relies on a network of private insurance funds, often referred to as sickness funds, which compete for members and negotiate for healthcare services with providers. This fosters competition and potentially enhances service quality and efficiency. State regulation. The government plays a regulatory role, setting minimum standards for coverage, ensuring the financial solvency of the funds, and overseeing overall system performance. Now let's see a step-by-step breakdown of how the Bismarck Model works. This model consists of 6 main steps. Payroll contributions kick in. Instead of relying on general taxes, the Bismarck Model is funded through mandatory payroll contributions. This means that both employers and employees dedicate a fixed percentage of their salaries towards healthcare insurance premiums. Enrollment made mandatory. To ensure broad coverage, everyone in the country is required to enroll in a health insurance plan. This eliminates gaps in coverage due to factors like unemployment or changes in job status. Sickness funds take the lead. Private insurance companies, often called sickness funds, serve as the primary providers of health insurance under this model. They collect the payroll contributions and are responsible for covering healthcare costs for their members. Competition spurs efficiency. Unlike a single-payer system, the Bismarck Model encourages competition among these sickness funds. They vie for members by offering attractive benefits, negotiating with providers for lower costs, and potentially driving innovation in service delivery. Government sets the rules. While private funds manage the insurance aspect, the government plays a crucial role in regulating the system. It sets minimum standards for coverage, ensures the financial solvency of the funds, and oversees overall quality and cost control. Accessing healthcare when needed. When individuals require medical care, they present their insurance card from their chosen sickness fund to the healthcare provider. The fund then covers the costs of the services, ensuring access without significant out-of-pocket expenses. Now, let's look at the strengths and potential advantages of the Bismarck Model. Broad coverage, financial stability, and competition and innovation are considered as main strengths of the Bismarck Model. Broad coverage. Mandatory enrollment leads to high healthcare access rates, reaching a wider population compared to systems based solely on voluntary insurance. Financial stability. Payroll contributions offer a reliable and predictable funding source, promoting system sustainability and reducing dependence on government budgets. Competition and innovation. The involvement of private funds can incentivize competition and efficiency, potentially leading to innovation in service delivery and cost management. Now let's talk about the challenges and considerations to think about with the Bismarck Model. Rising healthcare costs, social inequalities, and administrative complexity are considered the main challenges of the Bismarck Model. Rising healthcare costs. Balancing affordability with comprehensive coverage can be challenging, leading to concerns about rising healthcare costs and potential burdens on employers and employees. Social inequalities. While offering wider coverage than purely private systems, income disparities can still influence access to specialized care or treatment options. Administrative complexity. Navigating multiple private funds and understanding insurance plans can be complex for patients, and administrative costs associated with multiple insurers can exist. The Bismarck Model has influenced healthcare systems across Europe and beyond, and continues to be a subject of ongoing discussions and comparisons. Analyzing its effectiveness in different contexts, exploring potential reforms to address rising costs and inequities, and considering adaptations to evolving healthcare needs are vital ongoing tasks. In conclusion, the Bismarck Model offers an alternative approach to healthcare financing, emphasizing mandatory insurance, shared responsibility, and a blend of private and public involvement. If you found this video helpful, don't forget to give it a thumbs up and subscribe for more engaging content. Thanks for joining PharmaExplora today. Let's meet again with another interesting video.